Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
My name is Shauna Ryan. I'm the Community Outreach Coordinator for Southern 7 Health Department. Here with me today is Cynthia Tremblay. She is a Special Needs Specialist for Southern 7 Head Start. Thank you for chatting with me today. I appreciate it.
No problem.
Now, one of the goals of Head Start, Cynthia, is to ensure full participation of all children in all activities. How is this accomplished with children with Tourette's or even any other conditions?
Sure. Staff are given specific information on each child because even if you have two children with a similar diagnosis, it doesn't mean they need the same thing. So it's more of training on what is a concern for that child and how they can help them participate. And we would follow any information from physicians or from the school system if they have special education plans to make sure that they're involved in everything.
What are some accommodations or what are some things that are done in the Head Start program to help children, maybe with Tourette's, autism, and some other developmental issues?
One thing that all children benefit from is routine and structure. And that's something that it relieves stress, it helps children know what's coming next, and just keeps them on an even keel. So that works for any child of any ability. So that's the first thing that we do. But we have staff that receive specific training in what a child may need. Two children with the same diagnosis may need completely different things. So it's very individualized. So we work with the school if there's a special education plan or their physician to see what they need and to be with them, to support them in the classroom so that they can participate.
What if you have a child that comes into the program that has never been diagnosed? How do the staff deal with that? How does Head Start work with that family?
So we have screenings that we do with all of our children. We have developmental screenings, behavioral screenings, and then we have the teachers' observations in the classroom, and we might meet with the parents to see what their concerns are, and then we can make appropriate referrals either to the school system for children ages 3 and up, or to the state's early intervention system for those children under the age of 3.
Because, for example, with Tourette's, a lot of those kids aren't diagnosed until later in life, but you do see Tourette's, you see autism, you see other developmental delays, I'm sure.
Right, yes.
Yeah, exactly. So social emotional learning, mental health consultation, that's all part of the treatment plan in that respect.
Yes.
As well as helping to establish what type of education levels and activities and things for those kids. Is that what we're talking about?
Yes.
Then? Very good. Okay. Now, once the child has gone through the screening, let's say initially through the screening, and they didn't come to Head Start knowing that they had an issue, what happens from there? I mean, you mentioned the doctors, you mentioned, is there anything else that you do?
Right. So the whole time that we're working in the process of getting them some specific help for what's going on with them, we work with them the whole time just on what we see that they need, because none of these things are instant fixes. And so getting a plan with the school or the early intervention system can take a while, and we provide a lot of documentation and observation notes. So in the meantime, we just look at what's going on with the child. We use our own staff. We have a mental health consultant. We have other education staff. So we can look at what would help the child now so that they're not just waiting on something to help.
Okay. And do you continue with them past Head Start, or once they move into kindergarten, is that where Head Start pulls back and allows the schools to take over, I guess?
Sure. Yeah, we have a transition system where we help the parents, help the child, and help the school be ready for the child. A lot of times, if a child has special education services before the age of 5, we'll have a meeting right before kindergarten where Head Start staff and kindergarten staff will both get together to decide, what would work best, what we've seen that works, how it might be different in their classroom, and those kind of things.
Wonderful. So, for a parent who has a child that's diagnosed with a developmental delay, it can be very scary sometimes frustrating, but you provide the services, the information, everything that they need to get that child on track, especially as they head into kindergarten, which is a big thing. So what do you say to those parents who are concerned that they have a child with a delay or another issue? What do you say to them when they come into the program?
Right. What we would say is we're just looking at, we want to see where the child is at now. We're not focused on where they need to be. We see where they're at now. And we know what's usually considered developmentally appropriate for that age. And so we work on what it would take to get the child to that point. So, like I said, it's working with other agencies, working with the parent, but I always tell the parent it's so much easier to start when they're little than when they're older and, you know, maybe habits have been established that aren't helpful. You know, it's a lot easier to change negative behaviors and how they feel about things at this age because they're like sponges, so this is the time, and that's why Head Start is so important.
Very good. Is there anything else, Cynthia, that you want families to know as they're, you know, again, starting that journey of thinking there might be something going on?
Sure. There are lots of agencies out there to help. Sometimes you have to know who they are, but there are lots of agencies, counseling agencies, agencies that help children with special needs, and the school system. There are lots of people that can help, and if you have a child who is age birth to 5, we would be glad to help them at Head Start.
Very good. And the most important thing we want them to know is they're not alone. Especially if you're a new parent and you've never had a child before. I know sometimes that's scary,
right,
to think that something might be going on. And you know, as parents, we tend to think everything's our fault. And so it's important for them to know that, you know, you're there for them, that they're going to get the care that they need and the help and support that they need. So that's wonderful. All right, Cynthia, wonderful. Thank you so much for talking with me today. How can people contact you if they want more information?
They can contact me here at Southern 7, and our number is 618-634-2297, extension 9141.
Wonderful. Thank you again. Is there anything else that you would like to add?
I don't think so.
No? Okay, we're good. All right. Well, thank you so much for joining us today. I'm Shauna Ryan with Southern 7 Health Department. Once again, we've been here with Cynthia Tremblay. She is the special needs specialist for Head Start. If you'd like more information, please give her a call. You can also visit us online at southern7.org.